I said I'll be fine. I lied. I'm contemplating suicide. I said I'll get by. Oh, I tried. My hands and my feet don't move the same. This love will break this heart of mine. Even the greatest of soldiers need help sometimes. This storm will shake this house apart. Even the brightest of days need light sometimes. I said I'll get by. Oh, I tried, I cried. The tears on my face don't flow the same. I spoke to heaven, yeah, told them to ease my pain. The winds just got stronger, then the voice said, be brave. This love will break this heart of mine. Even the greatest of soldiers need help sometimes. This storm will tear this house apart. Even the brightest of days need light sometimes.
So let's do this. Kadenge.
Yes.
Welcome to our studio.
Thank you, Patrick. It's such an honor to be here.
Great. So I'll just go to maybe the conversation. We can start. Maybe I will want to explain a few things. One, I want to welcome everyone tonight for tonight's conversation. Tonight we are having a conversation with Kadenge Yaa. So Kadenge Yaa is an engineer. So basically he has developed a solution for access for healthcare for all, which is quality, which we have been talking about this conversation for a long time. So I don't want to go to the details of that conversation, but Kadenge will help us have that conversation tonight. If you want to join this conversation, it's very easy to join. There's a link on the comment section. You just click the link, takes you in. You'll be able to ask your question to Kadenge, or you can actually offer your perspective. Maybe also there will be a panel who will be joining this conversation. So we will actually have questions. Tonight is just Kadenge explaining about himself, his life, and also his solution. And then people will ask you questions, Kadenge. I hope you're okay with that. All right. So maybe this is just a normal conversation. So let's just start. Maybe you can start by introducing yourself, and then I'll go to the details of maybe you can talk about your own life, how you grew up, challenges, achievements, before even we go to the details of your solution. Yeah.
So as Patrick introduced me, my name is Kadenge. You can call me Kadenge Yaa, Yaa alone, Kadenge alone, any can do, yeah. Depends with the setting, obviously. I'm the tech lead at Uzima Health. So you can check out Uzima Health from uzimahealth.com, where we basically focus on technologies that will improve the health of our people, from access to healthcare to what quality that you access as a person. Yeah? So both we provide means in which you can access quality healthcare at all times at your comfort. And also we build systems that assist and facilitate health facilities, be it pharmacies, hospitals, labs, and any other form of a health facility to perform better, to work better, to offer services to their clients or patients digitally. So we are in this press to basically assist everyone in the healthcare sector to work and perform better.
All right, that's great. So we have many people will maybe try to join. Perpetua, nice to see you. I hope I'm glad tonight you found the show going. Hopefully you can be able to join. All right. So maybe now, Kadenge, just explain to us about your own life, just like a normal kid, yeah.
Yeah.
Where you went to school, and then we want to understand that, before we get even to the solution, we want to understand this mind. How was this mind nurtured until now?
Okay. Yeah. So, Kadenge, let me see if I can recap most of the events in my life. My life has been interesting. Like it's a whole story. It's a whole novel. We can spend the whole night here trying to explain how my life has been. Yeah. So I don't know where the echo is coming from.
Sorry, it's okay.
Okay,
I'm mute the mic.
So I was born in Kwale, to be specifically Ukunda. So for those who know Mombasa, you have to cross the ferry, the Koni ferry, and then you take a mat to Ukunda. That's where I was born in 1992, 4th of April. So it's been a month since I celebrated my birthday. Yeah? From there, I spent most of my time in Mombasa. Started schooling in Ukunda first, and then moved to Mombasa. And then challenges in life. I grew up with my grandparents for between my standard 2 and standard 5. So that is in Kilifi, in a place called Kinani in Kaloleni. So from there, I moved to town again, where I studied. I studied in Changamwe for my class 6, and then class 7 I moved to another school in Nyali called SOS. SOS stands for Save Our Souls. So basically it's a children's home, and it has an extension of a school which basically takes in students from outside that village. Yeah? And then from there, class 7, that's basically class 7 in SOS, and then I moved to Western now in a school called Mdiawari Primary School. By that time, it was the best school ever. It was performing far much better than any other private school. Hopefully, we can regain our station like back then. Yeah. So my standard 7, third term, and class 8 was in Mdiawari Primary School. And then I was privileged to land in Mangu. So I went to Mangu for a month, and then another letter came for Starehe Boys Center. So I also went to Starehe, and then I shifted school to Starehe. So it was my high school was fun, a lot of fun, a lot of learning, a lot of interacting with people. Actually, that's where I grew a lot in terms of how I think and how I associate with other people. Because now you're getting to Starehe, you have people from different backgrounds, from really underprivileged backgrounds to privileged backgrounds, all put together, and we are put in this system that is very disciplined, and that we act together as this. We are put in the same level, like we act as brothers. So it was very encouraging. So from Starehe to Jomo Kenyatta University, where I've been studying electrical and electronic engineering. And then I took, just as a hobby, earlier in 2012, I started doing a lot on software engineering. Basically, my focus then was that I build and participate in building systems that are focused on the people and directly affect and influence their way of life, their daily way of life. So that's where I learned most of the things surrounding software development. And earlier in 2017 is when we started Uzima Health. So Uzima Health has been here for 3 years now. Yeah. And it's been a challenge when we started, because the way we are thinking of the perfect solution for us is not conventional, especially in the African setup, where we are used to going to a hospital, doing a lot of paperwork, leaving that hospital. The hospital forgets about you until you go there again. So basically, that has been my journey. So unless someone has a question or something, they feel I've skipped something, or they know something in my life that I don't know.
They might.
Yeah,
They might. Yeah, they might. So
I know.
Uh-huh.
I know nowadays they are online. They are called online CIDs or what. So they usually have a lot of information about someone that even that person doesn't know. So
And that information can be used maybe for good or for also some other. I don't want to.
Rarely is it used for good. Rarely.
All right, good. So maybe I really want maybe this to be more, because people or young people want to ask you questions, because they also want to travel such kind of journey. They want to make a difference in this country, and they want to be part of this and produce solutions that actually maybe touch people or actually solve problems. So I don't want maybe we go more to maybe again maybe explaining more about yourself, but we'll come to it later as more people join. But I just want maybe people to ask you questions right now at this stage about your own life, how you started. Maybe I can bring them on. First, I would like to bring Conrad. Conrad is our resident analyst on the platform. So, because I understand Kadenge was your classmate, is it?
No, you should not try to bring me very early into the program when I don't have an issue to ask. I was supposed to ask about the questions regarding his solution, not his personal life.
I know. I really don't mind Conrad. Actually, I'm so excited to meet you again here.
Yeah, you have not met me because my phone is a bit. It does not have a picture because of some.
I can hear you.
Yeah, you can hear me, but what I was just supposed to say, like, let the rest continue. Then I'll ask the question, because I have the question about the application, not personal life. That one I'm not going to ask. I know you from very far, so I cannot ask you those personal life questions. Let us continue.
Okay.
Thank you, Conrad. Okay, that's fine. Okay, I will bring maybe Arnold. Arnold, you can introduce yourself and maybe tell us what you do, and then you can actually ask a question. We also, part of inspiration, we also want to understand someone's journey. It also gives more inspiration.
So, hi guys, my name is Arnold Muiti, and Kadenge is my colleague. So we work together in Uzima Health, the product manager. So like he said earlier, we started from 2017, and I'm just here to to see how this goes.
Yeah. Great. Awesome.
Yeah.
That's good.
And just in case I make a mistake, let's just leave it for Facebook, yeah?
Yeah.
Good. All right. So I want to bring Okoya to maybe to weigh in. Okoya, can you unmute your mic and then you can weigh in?
Oh, hello guys. My name is Brian Okoyo. Kadenge is my brother. We were in high school together, and I'm also in software development, but went into product management. Quite interested in telehealth, health technology, and all that. So I'm happy to be here. We'll ask more as we go on.
Great.
Yeah.
I'm glad to see you have a support system here tonight, which is
really, it's important.
And also good also to understand that even guys you schooled with in high school, they are part maybe, or even you went to campus with, they are part of people you can even work with. That means your trust level and how you have built relationship is so strong, yeah, which is really good. So now maybe Kadenge, now we want us to get to the details of this conversation about telemedicine, telehealth. Yeah. Now, maybe the first question I want to weigh in terms of, the first question you can actually give your perspective is in terms of COVID-19 crisis, and how does your solution offer actually access for doctors, especially now that people are quarantined at home?
Yeah. Maybe you can hold on that a bit, yeah? Just a second, yeah? So before we go to that, we need people to really understand what telehealth involves and telemedicine is all about, yeah? Because in most cases, when someone hears about telemedicine, what comes into mind is that you're talking to this doctor, or you're talking to a virtual doctor, or you're talking to a doctor who is on the other side, not with you at that moment. But telehealth itself is so broad. Yeah, at one moment, trust me, you've experienced telehealth and you didn't know that that's telehealth. Yeah. So telehealth itself means you get access to health services and health related services without actually being in direct contact with the person who is offering those services. Yeah? That can be the most commonly known or most commonly used definition of telemedicine, which is clinical consultations. And but you can narrow it down further to even the information that you get access to. If you have ever downloaded a mobile application that shares information matters health, you have experienced telehealth already. Yeah. If you have ever emailed a doctor, that's telehealth. Yeah. So what we are doing at Uzima basically is providing a mode that is more accessible to everyone. Yeah. Which basically right now we know is through mobile application, which can be is commonly defined as mHealth, yeah? which means mobile health. It's basically telemedicine, but now it's focused on mobile devices which are more accessible to people. So when we come to COVID-19, right now we are actually in consultation with a number of counties in terms of rolling out early detection system. An early detection system means we are able to capture community infections at a very early stage in the infection cycle. Yeah. So I'll take an example of what is happening in Old Town. Yeah. Before even it reached to that point in which it's now a big problem to the county and to our country as a whole, if there were mechanisms to monitor what is going on within the community, then we would not reach at that point where we have to close some areas and restrict movement in those areas. Yeah? Because by then, we would have the ministry and those people who are directly involved in ensuring that we get to the point in which we have much control of the virus, would have information regarding community infections at a very early stage. So look at it this way. With coronavirus right now, there's no known or tested remedy. Yeah? What works even for developed countries and to the countries that we can emulate that have done quite well in managing coronavirus is isolating the virus. Yeah. So basically what you want to do is to detect at a very early stage a person who is infected of the disease and isolate them from the population so that you prevent the disease from spreading within the community. So as Uzima now, we came up with a system that right now we are in the process of rolling out in Mombasa County and several other counties. As I think I mentioned to you earlier on that we had a conversation with Kakamega County surrounding the same things. This system is designed so as to detect at a very early stage community infections, because now we are past that stage where infections or people who are infected are coming from outside. People who are infected right now are our brothers, our sisters, our neighbors, you know. So it's within us. So it's up to us, it's up to the public to participate actively in ensuring that we contain the virus. Yeah? So in that regard, we design a system. This we call it event-based surveillance. Yeah? So this system is designed to monitor events that are of public health concern within the community. So look at it this way. Most people are not much aware of the exact symptoms or how to triage coronavirus, but they know when something is happening within their community that is out of the norm. Yeah. So I'll take an example of maybe my area where I am right now. Yeah? I know people here are healthy, everyone is doing all right, but we wake up one day and one of my neighbors is really coughing, is coughing bad, and then all of a sudden the symptoms escalate really fast, and it's a condition in which they can't move. Yeah? That's something abnormal and it needs to be reported, and we have built that mechanism in which the public, you and me, can participate actively in ensuring that this coronavirus is contained. So the system itself is really simple. Actually, you can test it on your side and anyone who is live can test it. We use USSD to make these reports because we thought of putting it on a mobile application. That means it will be limited to people who are using smartphones. However, USSD is available for everyone. Even the people in the rural areas are able to use the USSD to make such reports on what is happening within their community. And this information is aggregated and presented in a manner in which the ministry and the people involved can easily get information that will assist them make evidence-based decisions. Yeah? So you can test this actually. Anyone who is here can try it. You can dial *483 *007 hash. Yeah?
00.
So it's a very simple system. Yeah, *483 *007 hash. Yeah? 00. If you are a movie fanatic, you know what 007 is all about. Yeah. James Bond movies. Yeah. So, so we are here to work together, because we noticed there was that limitation for public to participate in this disease. So there are just people coming from outside. They come and tell you, "Oh, you have the disease." But now, as a person, you are not able to communicate to the authorities that something abnormal is happening in our community. Can you please come and investigate? Yeah? So using that, you can easily report something that is happening within your community. So the main reason we have the event-based surveillance system is basically to assist counties and the Ministry of Health as a whole to detect at a very early stage community infections. So, in addition to that, there's also another bit which is more interesting, and obviously it's the most commonly known and most looked for technology right now, which is contact tracing. So that's limited to the mobile application users. Right now, if you go to the mobile application, there's an option in which you can opt in for this technology. It's optional and it's up to you to consent, and you to be able to use GPS coordinates to track and trace your contacts. So should there be a case confirmed within the system, this is done, the confirmation is done by the ministry or the department, the health department within the county. Yeah. They are able to, from a click of a button, they are able to trace every person that came into contact with, to close contact with that case. Yeah?
All right. Great. Awesome. That's great. Now,
so I think I mentioned so much. I talked
which is really helpful in that conversation. Now, maybe can you explain to us before maybe I get the panel to maybe field questions? Can you explain to us when it comes to working with doctors and maybe clinical officers in your solution, how is the reception so far, and how do you work with doctors, and how do you make it happen? Kadenge, continue.
Yeah. So from the Uzima application, which is available which is available on Google Play, you can actually go and search for it, Uzima, and you get the Uzima app. You are able as a person to book appointments with doctors and consult with them. First of all, this has been a challenge. We launched this product earlier last year, and to gain traction at this moment, to this level, it was really difficult. It was a challenge because of what we know as the norm in terms of getting health services. So, for example, for you, I'm sure if you're sick, the first thing you're thinking of, I'll have to wake up tomorrow and go and see a doctor. Yeah. It doesn't click easily to everyone that you can actually, using your mobile phone, you can quickly dial in, look for a doctor, consult a doctor, and the doctor will give you directions on what you need to do next. Yeah. So basically, it's what we know as the normal. Yeah. And change is difficult for everyone. To tell someone, okay, you can actually do this as an option to this, it's usually very difficult. Yeah. So we have had that challenge, but through education, we have been sharing a lot of materials, and some of our doctors have been spending a lot of time to educate their patients that they don't have to go to the hospital every now and then. They can actually do follow-ups through the mobile application. Yeah. So right now we are gaining a good traction, especially now we are in that position where we are at a fix. Yeah. If you're at home and it's past 7, the chances are you will have to wait. If you get sick, you'll have to wait till the next morning. Yeah. So people are using the mobile application much more than before because of of the need that is there currently. Yeah. So to use the app itself is quite simple. You go to the app, there's a lot of content that is shared by doctors. So first of all, you don't really need to book a consultation with a doctor. You can go through the app, look at what doctors are talking about, especially right now they are sharing a lot of information on maternal health. They're sharing a lot of information on coronavirus. So that's accurate information. Yeah? Rather than Google, you can use Uzima app to do that. Yeah? Yeah. And in addition to that, you can use Uzima app to talk to a doctor. Personally, I use it often. I think I mentioned to you an example. Like last week, I was a few days ago, I was feeling really ill, and I was in my bedroom. Yeah, so I was like, okay, I can't get out right now, and I'm feeling weird. You know, sometimes you just wake up and the body is not normal. Yeah, so I just went to my phone, looked for a doctor. I talked to a doctor. I don't know if my appointment is still active. I think my appointment is still active because the doctor is doing follow-ups with me to ensure that I'm improving. So I talked to the doctor. He assured me that I'm okay. I just need to take a bit of rest, and maybe my body will reboot and I get to normal. So getting those little assurances is really important, and you don't really need to go to a hospital to get that.
True. Yeah. Right. Maybe now, maybe I want Conrad to ask question, and also maybe Insta will introduce herself, and if she has any question or perspective to this. Conrad, can you maybe restrict your question on how we can make access for doctors for all in Kenya?
Okay. It is a privilege to discuss with him this issue, because one of the things that came about this discussion was a previous discussion where we are discussing about another previous issue concerning how the people from diaspora can be able to help. And it was Dr. Obare who told us, I think it was Pam, in our previous discussion, who told like how much help can they be able to give as doctors working in diaspora to help people living this side. So my question is about, he has not explained much about it, so I think I wanted him to explain more so that I am able to understand more about the application, because I've looked at the application, I've looked at it, I wanted to use it for something else, but I didn't manage to get the time to use it, because I wanted just to use it as a test and have the application on my phone. So my question was regarding the uptake. So how far has been your uptake concerning the people, for example, the laboratory side, the doctor side? How has been your uptake? Because that is what I was looking at. I've seen there's been an improvement since the last time I looked at the app. The second time I look at the app, there's some good improvement. How much has been uptake from the doctor side to take that initiative to look at it, so that I can ask the preceding questions?
So the first question was on doctors in diaspora.
Yeah.
So actually right now we are running an initiative with a number of doctors in California who are in the front line in fighting coronavirus. Yeah? So we are working closely with Kakamega to run a pilot on how this program is going to run. So these doctors will be communicating with the doctors here in Kenya through the mobile application. There's a doctor's mobile application, specifically designed for doctors. Yeah? They'll be communicating and sharing knowledge on coronavirus. Yeah? For doctors in the diaspora, they can actually offer help using the doctor's mobile application. All they need to is to go to the mobile application and register, and they will be taken through a verification process. We have a number of doctors that help assist in doing so and ensuring that we only have capable doctors within the system. So we are looking at a situation in which we have so many doctors in the diaspora offering help to our people through the mobile application. Yeah? That means if you want to talk to a doctor, even in the US, you can actually go to the app, book an appointment with that doctor, and then talk to the doctor, and the doctor is able to refer prescribe drugs to you, or request a lab and send you to the nearest lab for the lab test. The results are sent to the doctor, and they're able to make a very conclusive diagnosis and prescribe the right medicine to you. So, in terms of doctors um, working in telehealth from the diaspora, Uzima app provides that as a solution. Actually, that was our main goal. There are so many doctors out there that are willing to assist us, to assist their countrymen, but there's no means available for them. Yeah. So using Uzima, the system, they are actually able to do that. And right now we are testing that program for coronavirus, where doctors in the US, where we have willing doctors already, can work with doctors here in Kenya to share information, and also they can consult with patients through the mobile application. So the other question was on uptake of the system. So Uzima Health itself is so broad. Right now we are talking of a very small segment of Uzima. We are talking about telemedicine. We are talking about the mobile application. Uzima Health itself is a health management information system, which basically runs for health facilities, be it hospitals, or all levels of hospitals, be it pharmacies, labs, and so on. Yeah. So currently we are still running a piloting program with Kitui County. So we have been running this program since towards the end of February till now. Yeah? And it has been really successful. The challenges came with coronavirus. Now we have very limited movement, but still the system is running a number of facilities within Kitui. And the same, we are supposed to be rolling out towards the end of March in Machakos, a piloting program also in Machakos. And that one has been put on hold as we have this current challenge that we have to tackle first. Yeah. So in terms of uptake, we are gaining traction, and we really appreciate that. Yeah. Because in 1 or 2 weeks, we'll be rolling it out and testing it here in Nairobi. We are working on a partnership with Nairobi County to start a piloting program in Nairobi County and see how we can use Uzima system to integrate and facilitate collaboration across all facilities. Yeah? So that's Uzima as a whole. Uzima is so big. Today we'll be focused on a very small segment, but that's just enough for today. Yeah.
Yeah.
So in terms of uptake, right now we are gaining good traction, and it's really encouraging that people are starting to appreciate that telemedicine, telehealth is the future of Africa because of a number of reasons, and one of them being that as a developing country, we still have limited resources in terms of in health. A lot of people in rural areas have very limited access to quality healthcare. They might have access to healthcare, but does it reach that level that we all are looking forward to? Yeah. Okay. So with telehealth, then we'll be able to solve that problem.
Good.
So I don't know if Conrad have answered your question, or there's something missing, or you need clarity in a statement or two.
We'll come back to him. We'll come back to him when we go around. Yeah? But I just want to come to maybe get those on the studio maybe to fill a question if they have any question or they have any perspective to this topic about telemedicine. Easter, I don't know if your network is okay, but are you there? Easter? Are you there?
I think she's frozen.
She froze, eh? All right.
Yeah.
So let me bring Elvis. Elvis, hi.
Hi, Sama Kadenge.
Poa sana. Hi Elvis. It's nice to meet you.
Nice to see you.
Oh my goodness. I have a supporting team here. Oh, everyone is here.
Yeah.
Oh, yeah, too.
Yeah,
Yes.
no, I was scrolling down Facebook and I saw the live feed and I decided, I'll join and listen. So I have a couple of questions. So basically, I think, first of all, I'd like to commend you. This is an amazing idea, especially during these coronavirus times. But I understand that the application can be used. The application is helpful even, outside these times. I think with the focus on maternal health, I think that is a great application. So my questions are not going to be on the app per se, but on the side of funding. From the funding side, are you looking for new investors or what is the situation?
Yeah.
It seems I have an investor on board here. So for that one, we are still in that process. We are a young company. We are still growing. So there are still a lot of opportunities for investors that share our vision. Yeah. So the most important thing is for investor to see our goal, because it's been a tough journey. Yeah. But we are willing to have discussion with investors and see how they can participate and offer their support towards reaching the ultimate goal, which is to ensure that everyone has access to healthcare and quality one. So you can actually inbox me, and then just in case you want to be part of us, we can actually continue the conversation. Yeah. So
Okay. Sounds good. Okay. All right. Thanks.
Oh, sure.
Right. Elvis, do you have any other question or you're good? All right. So let me bring.
No, I'm good for now. Yeah.
Okay, good. So Okoya, do you have? Let me bring Okoya. He has a question. Can you unmute your mic? Okay, good. Maybe you can field your question.
Yes. Again, hi Elvis. Niko salama. So, Kadenge, I have a question on the Uzima Health app. My main question is, diagnosis is a very important bit of the medical care, the whole medical care procedure, the whole cycle. So, at what point do you diagnose during the doctor's consultation before he actually prescribes or gives a solution, or how do you go about that, especially on the diagnosis and at the diagnosis stage of the care?
Okay, good question.
Yeah, so to answer that, Uzima app provides 3 modes of communication to a doctor. One, you can do the chats, you can do voice calls, and you can do video calls. Yeah? The most commonly used is video calls, because in most cases they'll have a physical, they'll see each other. You see the doctor, you see the patient. Yeah? And also this Uzima app is not just a connection between you and doctor. The Uzima ecosystem itself has pharmacies, has labs, and has actual hospitals. Yeah. So during a consultation, a doctor can determine whether for them to make the correct diagnosis, they need to request a lab from you. Yeah. If they need to request a lab, they can actually do so in the app, request a lab, and send you to the nearest lab that is within the system. Yeah. And that request is sent directly to that lab. You just need to walk to that lab, identify yourself, and they are able to identify you in the system. They know which lab has been requested. They do the lab. They send the results back to the system, which means the doctor will be notified. And now the doctor can make a more informed diagnosis of you. So in some cases, of course, a doctor can just look at you and can listen to you, and they know, okay, from what the symptoms that you are describing and how you look, this is the diagnosis, and this is the prescription that I can give you at this moment. However, in cases which is a bit complex and they need confirmation, they can actually request for labs. And if it escalates further, they can actually book you in for a physical visit to an actual hospital that they work for, or they can refer you to the nearest hospital within the system. And all that is done within the ecosystem of the system.
All right, good. Thank you. Now I want, maybe I don't know if Insta again, she froze. Insta, are you there? She froze again. So I'm sorry. Our network is maybe terrible or something. Yeah. So Anna, do you have any perspective at this point you wanted to bring in? Anna, can you unmute your mic?
Unmute your mic.
Okay,
Hello.
good.
So I'm saying maybe I'll help out in answering some of the questions about telemedicine and the system.
Okay, good. We'll get to the system. How maybe you can explain more details, the engineering factor.
Actually, when it comes to the business, the core business, he understands it better than I do. I'm more on the development side, though I do a lot on management and business development. But basically, from my work revolves majorly on conceptualization of ideas, development, and implementation of such.
All right, great, awesome. Now, Arnold, maybe Wekesa, if Wekesa was here, is a sales and marketing specialist. We could have gotten is part of how maybe the market is getting your product. But maybe, Conrad, can we now field a question in terms of, is this actually the revolution in healthcare that we needed? Is this telemedicine? Is telemedicine now the real thing that we need in Africa to achieve the doctor-patient ratio?
Definitely. So as with any other product in the market, it takes some time to penetrate the market because you have to learn exactly what the market needs. And on our side, we had to measure exactly what is needed by the market and what exactly motivates the doctors. So we do that by running ads, of course, and then engaging with patients. So definitely, I think telemedicine is one of the things that as a country we should really adapt, especially at a time like this with coronavirus. So, and I should say for the past few weeks, we've had more consultations than before, because of course the people at home who want to see doctors are using the application.
All right, great. So maybe I want to bring Conrad. Conrad, are you there?
Unmute your mic.
Yes, I'm here.
Yes, Conrad. I think we have this. Listen. I don't know. Are you okay now?
Yes, I'm okay.
Yeah, but still, yeah. Okay.
I don't know what's the wrong with my mic. I can hear you, but
let me see. Are you okay? Still,
yeah, I'm okay.
All right. So when we are talking about universal healthcare, what maybe do you think like Kadenge when they are coming up? What is the main thing in that solution?
I think the problem your your mic, I think I can't hear it properly, but I think what I could hear from you is what is the place of Uzima and the likes of such likes of application in advancing the universal healthcare agenda. I think one of the things we discussed this issue about universal healthcare, like there were three triads. There's the cost implication, the quality implication, and the access. So I think part of the thing that is the likes of Kadenge, they are addressing, the application is addressing, is about the cost implications, the cost and the access, because part of the things that people don't have is the access to the right medical care to advance whatever they have, because we have so many, you can have a certain ailment, but you don't have the right access to the right doctor who can give the right diagnosis for the right ailment you have, so that you don't waste a lot of time moving from one place to another. Because I understand this from a perspective from where I come from, where we have to go to, if you have any other complicated issue, you have to go up to MTRH, which is Eldoret, which is very far from where we are. So we look at that, that is the point of access. But if you have the right access to the right doctor at that certain time, you are sure that you will ensure that the doctor will give you the right diagnosis and will take you to the right place. So that addresses the point of the access part. So the other point that it addresses is the implication of the cost, because the cost implication is about the cost implication is about the how much are you paying for that consultation. I've looked at they are costing. There were several doctors who are costing. What is their qualification? I've looked at it. It's a cost considerably much less than what in a conventional system they'll cost, because we are looking about the transportation costs to go to the right doctor. You'll go to one doctor who will give you the diagnosis, to the other doctor who will give the diagnosis to the other doctor. So if you look at the cost implication, only transportation bit, we are looking at it in a perspective where the cost implication is very huge. So I think it addresses those key issues which we looked at in a previous discussion, the cost implication and the access implication. Those are the two things that can address. If you want to do universal healthcare system, we look at the cost implication, we look at the access implication, because those are the two things that will address the universal healthcare. If people cannot access the right specialist for their right diagnosis, for whatever they have, it will become an issue. So I think that one is something that they are addressing, which I applaud them. And probably as we continue the discussion, I'll be able to ask more questions. So let me try to sort out my microphone. It can be noisy where I am, so let me try to address my microphone issues. Then I can be able to talk much better.
Okay, thank you. Okay. So I understand. So I will. I don't know why whose echo is. Am I okay now? Good. I'm sorry. I thought it was you. Even it's not you.
It's going on.
It's echo, yeah. So yeah. So how do you, by the way, Kadenge, address the issue of cost and access at the same time? Maybe make profit, because I understand this is business. So so how are you mitigating those terrains?
So right now we are in that stage where we are investing. We haven't, we are yet to break even, but we are estimating maybe within a year we'll be able to break even, where we reach a point that the cost of maintaining and running the system is at least equal to the profit that is being generated by the system. But before then, we focused, we put a lot of focus into ensuring that the services that we offer are affordable to all people that are using will be using the app. So the first thing is that we have quite a wide range of doctors. So we have from clinical officers within the system that we charge between 200 to 500 shillings. And then we have specialists that we charge up to 2,000 for a consultation. Yeah? So there are those caps that we have put in place, and we have come into an agreement with the doctors that we have within our system that we need to do that to ensure that everyone has access to these services. Not just only the people who are capable will be able to talk to doctors within the app. So at any moment, if you go to the app, you'll be able to find a doctor that fits your pocket. And that's really important.
That's very important, especially maybe when we are talking about rural places, those places where those people might die without ever seeing a doctor, right?
Yeah.
And I know maybe when in other countries in Europe or even the US, this might not be the case. But in Kenya, there are instances where maybe someone can die without ever seeing a doctor completely.
That's for sure. Actually, we are in discussion with Kilifi County on implementing telemedicine in a way in which we could have booths in very rural areas where someone can walk in and have a telemedicine session, a consultation with a doctor who is in town. Yeah? You can remember that access to smartphones and these technologies that use internet and so on is quite limited in rural areas. Only a few people, you might find only the chief has a smartphone, and the smartphone might not be as good as it needs to for you to have a very successful consultation. So we are in discussions to implement a system in which facilities, very remote facilities, can have a booth in which a patient can walk in and talk to a specialist within town. And the main focus for this is on chronic diseases that, for example, diabetes, hypertension, the ones that when you have it, you have to just control it and so on. Yeah. So such people can have follow-ups from remotely without having to see a specialist, a diabetes specialist. Yeah? So that's what we are working through. So it's not just for smartphone users. We are trying all ways possible to ensure even the grandma in the village who is maybe diabetic is able to access quality healthcare services by having access to a specialist who is far away in a town.
Okay, good. Thank you for that. Amazing. So, Wekesa, I want to bring you in, Wekesa. Yeah, maybe I want you to do a quick introduction, and then you can field your questions to Kadenge. Yeah.
Sinanga maneno mingi, mi naitwa Wekesa Eric. I am in Masaku County. I heard you are planning to do a pilot project in Masaku. You are welcome. I am in sales and marketing. So part of my interest will be in that field. Yeah.
All right. Maybe Wekesa, do you have any question at this point to Kadenge?
Okay. First of all, I've listened to you offline, or at the not offline, but the background, and I've heard quite. It's an interesting application, and congratulations for You told us Arnold is the engineer. Congratulations for the engineer and the
Let's correct that.
Kadenge is the developer of the idea, or what? But
No.
I think they are working in collaboration, so they own the idea. That is good. Maybe I wanted to to ask you, have you ever heard of, let me begin from my own field of marketing. Have you ever heard that it's easier it's hard to sell pork in
the mosque?
In the mosque.
Yeah. It's a common cliche.
Okay, and it could be like you love pork, isn't it? And
Yeah.
it's very sweet. But sometimes you may find it hard to sell the same pork you love eating, isn't it? Anyway, I should not be beginning by negative comment.
No,
Anyway.
It's not negative. It's not negative. Actually, it's so amusing. I like it.
But I'm just feeding you with the reality of marketing products.
Yeah.
One of the things when we got in the market, you have to understand the market dynamics. And sometimes you come up with a great idea. You are even vibrating with it. But when you go out, the way people receive it and perceive it and look at you, they reduce you to nothing, and you wonder, what the hell are these people? Yeah, but that is just the market dynamics. So I want to ask, okay, what is every product has a market segment? So in your own understanding, what is the market segment? Which means which kind of people are you targeting? Because there are high-end product and low-end product. There are people who don't. Okay, let me give you an example. A few companies are using these applications in terms of marketing, and for the users now, they find it. You go and implement to some of the, maybe your sales guys, and they find it so difficult to work with that app, so they prefer doing the manual work they are used to. So I'm saying people are made up of culture and habits. So how are we going to break the mold of the culture and the habits so that majority of Kenyans can understand and buy your idea? Two, we are talking about market barrier. Your greatest barrier to this telemedicine is technology. Most parts of our nation are still in Mulika Mwizi era, and some so may not quite connect with your idea. How are you selling this idea to the government so that it can be attractive in terms of implementing it to many parts of this country because of that technology challenge? Maybe you can answer those two, and I may add one, and then we move on.
Okay. Kadenge?
So first thing we'll talk about is basically market segment, and then I'll come to the technology challenge that we have. Yeah? So to start with, Uzima Health, when we started Uzima Health, the first thing that we did was usability studies, which basically means we visited doctors, we visited facilities, a lot of them. We had usability studies with mothers. So For a start, I think you joined a bit late, but for a start, Uzima Health itself is an ecosystem, a health ecosystem that involves all stakeholders in the provision of healthcare. Yeah, that's hospitals, pharmacies, labs, and so on. All these different entities are connected and within the Uzima ecosystem network. Yeah. So we did research on the hospitals, on doctors, how doctors perceive the mobile application, and then we also did a lot of research on patients, how they perceive telemedicine, because in most cases you'll find out people don't really understand what telemedicine is all about. Yeah, they know they're used to this. You are brought up in this culture where when you get ill, you have to see a doctor. Yeah, if it's not a doctor, you'll go to a herbalist. Yeah, but of course, people. Yeah, it happens, especially in rural areas and also even in towns. When kikishindikana hospitali, you look for the next best option, which is basically a herbalist. Yeah, so you call your grandmother and so on to find the best herbalist around. So, in terms of identifying the value that we bring to the market, we fully depended on research. Yeah, like the beginning of last year, we were building a product within the mobile application for pregnant mothers, basically related to maternal health, where we were trying to offer mothers access to a doctor. So they're able to join these chat groups within the app for their months, and within the chat group, they have access to a doctor where if someone says something, the doctor is able to verify whether that information is accurate or not. Yeah, and it was very interesting because we ran that for 3 weeks, three consecutive weeks, and you'll find out that these people are willing and are looking for this product. Like they find it, they have that wow factor. Like, is it possible that you have this doctor that you can talk to whenever you have this feeling that is out of the normal? Especially, and we notice that is common for first time moms. They have a lot of fear and they are googling all over and they're getting all this information, this wrong information. Yet you can go into an app and get access to a doctor. Yeah? So we built a product specifically for mothers. Yeah, and the reception for that product has been great. Yeah, we have been gaining good traction in that product. So Uzima Health, the Uzima app as a whole, for a start, we generalized it. Yeah, we generalized it. Anyone can access the app, and then now we are building what we are doing right now. We are building products that are focused on specific segments. Like recently, there have been discussions on building a product that is focused on the diabetic patients and hypertension. Yeah, and before we do that, we have to run through a number of usability studies where we identify users within our communities from different uh, social groups, the poor, the middle class, the upper class, and we bring them together. We have like 10 per session, and we talk about the Uzima, and they are able to test the prototypes and see their reaction. Yeah, before we take a product out to the market. So before we take any product out to the market, we usually like to do the usability studies to really ensure that whatever we're bringing into the market really fits the segment that we are trying to solve problems for. So in terms of market barrier and specifically technology, I think I mentioned earlier on that we are currently working on a USSD based system that is accessible to even the grandma in the village. Yeah. So the USSD, of course, is limited in terms of access, what you can access through the mobile app, the USSD, but a number of functionalities have already been identified, and we are currently incorporating that. Yeah, I think you tried it, Patrick. I don't know if you did, but there is that's an extension of that is being built. Yeah? And I also mentioned that with counties, we actually acknowledge that there will be a technology barrier, especially for people in the rural areas to access doctors through a video chat or so, because in rural areas it's even there's one phone, like there's likely one phone in a number of households. Yeah. So if they want to call, you'll be told, go to this, hello, PG, so and so. Yeah. So to solve that problem, we are in discussions, for example, with Kilifi counties, where they are able to establish booths within in these remote areas, so they can identify a number of clinics or dispensaries in those areas and establish a booth, which basically will have access to the internet and a tablet. Yeah? So a patient can just walk into the dispensary, and should the clinical worker there be limited in provision of accurate diagnosis to the patient, they can actually dial in for a tele consultation with a doctor who is within in town, in a number of miles away. So I think, I don't know if I answered you correctly, Okesa, or you still have a number of issues that are in doubt.
Uko sawa. So hiyo ya boot unatuletea simu ya jamii tena.
Kidogo, lakini the point is tunataka at one moment is that every follow-up, unless it's an emergency, can be done without the need of a patient to walk into a facility. As I mentioned, Uzima Health itself is a hospital management information system. Yeah, it's a whole ecosystem for doctors, facilities, and so on. So when you walk to facilities that use Uzima system to manage their operations, when you leave that facility, doctors can follow up with you using the mobile application. So it doesn't stop. Right now, I'm sure most people are used to walking out of a health facility, and immediately you walk out of the gate, the provision of health related services stops there until the next time you walk in again. But with Uzima system now, it's different. You walk out of the hospital, you can go at home in the evening. The doctor can ask you whether you're improving or not through the mobile application, and you can actually be sending reports now and then on whether you're improving or not. And if you have a chronic disease, unless it's an emergency, you can always consult with a doctor using the app without having to go to the actual hospital.
Okay, now my next question will be, within your product, are there automated services? Where, for example, when I'm using a mobile, maybe to recharge my DSTV, I'm told for the particular kind of service, go to number 1. For this service, go to number 2. For this service, go to number 3, until I find the exact service that I want. And some of them can be solved in that automation kind of interaction. And when I'm talking about automation, I'm focused on what the society is doing. Majority of people do what we call self-medication. You get symptoms of a particular disease, then you imagine this can be malaria, and you go and buy a malaria tablet. So for this particular application, are there chances that when I use the application, I can get information that can lead me to self-medication, even without interacting with the doctor? Maybe they are automated services. Yeah. Then the last
I'm
one,
listening.
okay. The last one I wanted to ask.
I'm listening. You can go on.
Yeah, the last one I wanted to ask is about conmen. Yeah, whether I will be sure I'm speaking to the doctor or a man from maximum prison who has just hacked into the system and is using that to con me. So how is your product safe from hacking and conmen?
Okay. So to start with, you have talked about automated services, and I think you are, in terms of automated services, your focus is on self-medication, where you can go in and dial in your symptoms, and the system tells you, okay, you go and take Panadol. It should be so. I think your focus is in that area, or
yeah, either it's it guides me towards self-diagnosis to know that I'm suffering from this disease.
yeah. So the main reason why we have doctors within the application, and we didn't really focus much on building an AI to assist you in self-diagnosis, is that you have an access to a real doctors. Yeah. This is from usability study. There's something the doctors say that you can't really eliminate contact between a doctor and a patient. Yeah, you can try as much as possible to build the best AI, but at the very end of it, even after you recommend using the AI, you will tell the patient, "Hey, you really need to go and you really need to talk to a doctor for them to give you a more deterministic answer around surrounding this." Yeah. So our main focus is that you stop self-medication, because now you have access to a doctor wherever at whatever time you need to, yeah, within your house and so on, yeah. So ukiumwa na kichwa, rather than uanze kujitreat na antibiotics, you can actually talk to a doctor na atakwambia with that one kunywa tu maji. I can give you an example. I think I mentioned it, yeah, to you, that last week I was feeling really ill. Yeah? If I was to self-medicate, trust me, I would say I have malaria, because I had all the symptoms. I was feeling pain, I'm feeling a bit cold. But when I talk to a doctor, they say, "Do you have fever?" If you don't have fever, then there's no need of prescribing you any medication. Just take a rest today, and then tomorrow we'll do a follow-up. Actually, I still have the active consultation. It's not yet closed. Yeah. You will have, now that's the whole point of eliminating self-medication, because otherwise I would have treated myself for malaria, yet from an informed point of view, I didn't show one more symptom, which is really important, having fever, to show that there's infection in my body. Yeah. So we are trying as much as possible to minimize and eliminate self-medication. You always have access to an actual doctor. So the other issue here is on conmen. One thing is that for a doctor to get into the system, it's really hard. Actually, you'll notice that we have, right now we have a very small number of doctors, because we have to take them through a very rigorous process of vetting. Yeah? And we work closely with a number of doctors that assist us in doing this, because we are building that technology to enable that process, the telehealth process, yeah. But to ensure that we have everyone within the system, every doctor that is within the system is verified, we work with a number of consulting doctors to ensure that that is so. So at no moment will you ever find a con man or the likes of prisoners within the system, yeah. And it's monitored closely from our side as well. You know, this is more like a hospital, yeah. So we monitor it very closely that to ensure that everything that is happening within the system is as what we expect it to be. Yeah? So anything abnormal, there we have mechanisms to capture that. Yeah. So have no doubt you'll always have the best doctor within the app.
Okay. Then maybe the last one is it also a management tool?
Yeah. So in broad perspective, it's a management tool. As I mentioned, Uzima Health is an ecosystem, is a whole ecosystem. What you see as an app is just an access point for a patient. Yeah. But there is access points for administration within facilities. There's access points for lab technicians. There's access point for doctors within their facilities. There's web platform that is so robust that involves all these things. Yeah? There is even access points to counties, to the Ministry of Health. So it's a really it's a really big system. So it has all those aspects, and management is one bit of it, from procurement, administration, and all other aspects. Even for yourself, the purpose of having the patient application is for you to take control over your health. Yeah. So through the mobile application, you can actually see all the consultations that you have, all the hospitals visits that you have ever had with any facility that runs Uzima system. So if you walk to a facility that runs Uzima system, for example, what we are trying to achieve in Kitui is that when someone is referred from a very small facility in Waita, which is in Mwingi, to maybe Kitui Central, when they go to Kitui Central, they don't have to carry papers and reports from all the doctors from there. When they walk into the level 5, all the information related to health from all the facilities they have visited within the county is shared directly to the doctor so that they are able to make a more informed diagnosis, and of course that facilitates better outcome.
Right, good.
Okay.
All right, so maybe I want to move to the question about data, since you mentioned about data. So maybe Kadenge, this has been a very interesting conversation even before, because we have been talking about data, how secure is data, how patient doctor confidentiality in terms of how that data runs in a system. But recently, maybe we also there's some research which has been done by maybe independent companies, which showed that maybe data is not what a patient looks for, or even a client looks for. What clients is looking for: a system that is efficient, easy to use, and serves their purpose. So, in terms of data, maybe what do you have to say, maybe for people as well as even doctors who care about that?
Yeah. So in design, the first thing that we really considered is that as Kadenge, as Patrick, as Conrad, we are able to take control of our health. That means we have control over who sees our information and when they see it, and we can enable and disable that at any moment in our life. Yeah. So if you walk into a facility and they are requesting for specific information, you can enable it, you can consent for it to be shared, and you can deny it. Yeah. So one thing is consent. Yeah. When it comes to information sharing and data, is consent. Do the people who access this information have that permission to do so? Yeah. So for Uzima itself, we have built such a robust access control system within Uzima within Uzima ecosystem to ensure that only those who have permissions and the rights to access sections of the system are able to do so, yeah, and any other person is denied, yeah. And in terms of storing the information, we always ensure that if we are transmitting the information over a network, it's always encrypted, yeah. So even if you snooze and you snoop and you try to get all that information, you won't be able to decrypt it, yeah. So as a patient, you're always confident that this information that is saved within the system is secured at all times, yeah. So those are some of the measures that you put in place, apart from in addition to two-factor authentication for logins, for sensitive logins, for example, for doctors and so on, for lab techs. We ensure that at all times you verify your identity, and we are in the process of incorporating biometrics for hospitals, so that access within the hospital setups, they always use biometrics.
No, good, good. Thank you. Maybe Conrad, I want to come to you. I'm glad Conrad found somewhere we can see him now. So Conrad, you can field your question.
So my question is about, I had asked it earlier, but let me frame it much better. How do you incorporate on probably our diaspora network, especially doctors who are ready to volunteer without charge in the system? How does your system incorporate them into the same platform where they can be able to offer their expertise free of charge without any other charge attributed to them directly?
Yeah. So actually, I'll be very excited to find those doctors, because I think that's what accessibility to and to healthcare is all about. Yeah, we want to ensure that your pocket does not deny you access to quality healthcare. Yeah. So it's so easy for a doctor to be on the system. All they need to do is download the Uzima doctor application. Yeah? They register through it. They will be given a call, and they will have a video call, and we'll have to verify their papers and their identity, where they work, and so on, before we allow patients to have access to them. So it's quite straightforward for doctors. All they need to do, we have tried to simplify the process as much as possible. So if they want to, any doctor wants to offer free services within the system at their own, you can switch on your online status on and off, so that a patient is able to see you. Sometimes they are not in the system. For them to do so, all they need to do is just download the Uzima app. Yeah, download the Uzima app. If they have a problem, we have support@uzimahealth.com. They can email us, and we'll follow up with them. So it's quite straightforward for doctors to get on board. It doesn't matter where they are. Right now, we are looking for doctors who are abroad, doctors who are not even as I mentioned. I think I mentioned when we were starting this conversation, that right now we are in conversation with a number of doctors in California. Some are Kenyans, others are just doctors in the US, and they find it interesting to assist other doctors here in Kenya, and also to assist patients directly from Uzima.
Great, good. So maybe now, Wekesa, do you have any question in telehealth? Because I want to move to what really inspires Kadenge to come up with this solution. Everyone has an inspiration that drives the solution to bring to a community. So maybe do anyone has any question on telemedicine? If there is none, I want to move to the inspiration part.
No, my last question will be in terms of follow-up. Does the application have, for example, if you have I have interacted with a doctor And maybe another time I have a problem. Does the system have maybe when I meet a different doctor, does the system have information storage such that the new doctor can refer to what the previous doctor has been doing concerning my health?
Actually, that's the gap that we are trying to bridge here. So, if in your case you're using Uzima app, you talk to this doctor today, tomorrow you are talking to a different doctor, or you talk to this doctor and they refer you. We usually advise that if you are not sure how you're feeling, always consult a general practitioner, a clinical officer, because then the general practitioner will know exactly what specialist you need to meet to consult. Yeah, because as a person nikiumwa na mbavu, then I'm thinking I need to talk to a chest specialist. Yeah, but you might talk to a general practitioner. They identify the pain and they tell you, hey, for that one you need to see a cardiologist. Yeah, so they will refer you through the system to a cardiologist. Yeah, so when you go to the cardiologist, all this other information that the doctor, the previous doctor has recorded within the system, that information is shared with the cardiologist. However, you have that control as a patient to consent for the information to be shared or to decline. Yeah. So at all times, we want you to have control over who sees your data. You know, health is sensitive. Yeah? You don't want anyone that will go and see her to have all the access to all your records. Yeah, you usually want to control who sees your records. So we have moved that control from the hospital setup, and we are giving you partial control over your information. Yeah? So every time you see a new doctor, your history, your clinical history that is within the system can be shared with that doctor upon your approval.
Okay, and then in terms of, can I access my insurance services, my health insurance services through your application in HIF status? How do can I get all those services through your application?
So in terms of payments, right now we support M-Pesa payments. They are fully automated. However, we are working through for facilities. For our facilities, actually, they can process insurance payments through the system. Now, however, for the app, we are still working through with a number of insurers so that you are able to access that also through the app. Yeah, because this is a new thing when it comes to telemedicine. Like most of the insurers are still working through their policies regarding this area.
All right. You are satisfied, Wekesa?
Yes, yeah, niko sawa.
Good. There's Cliff joined. I just want to know his perspective. Cliff, are you there? Okay, it seems there's an issue with me. Okay, we lost him. So anyway, Kadenge, what really inspired this solution? Where did you get inspiration that you felt you can actually solve this issue in telemedicine where we have issues in access?
So to start with, I think I mentioned during in my growth as a person, at one moment I lived with my grandparents. Yeah, so it happens that my grandmother is diabetic and also suffers from hypertension. So for her, she's very lucky. Yeah, she's very lucky in that way that most of my aunts and some of my uncles, are either doctors or nurses or clinical officers. So anytime she's in need, she'll pick a phone, call my aunt, ask 1, 2, 3 questions. My aunt will tell her, okay, you need to change your diet. Kesho utakula cucumbers and 1 piece of ugali. Yeah. So for her, she has been able to live quite a normal life. Yeah. She's always healthy. She has access to the right information. She has access to the right nutrition. So, for example, last year we had a wedding for one of my cousins, and during the wedding, aliambiwa unaweza kula nyama lakini just 1 piece. Yeah, yeah, you know. But if you look at it deeply, you'll notice that that is not the case for every other person. Yeah, for every other diabetic person, they don't have that privilege of access to this healthcare workers and professionals that can give medical advice at their point of need. Yeah. So to bridge the gap, then we sat down with my team, some of the first people that we had on board, and said, okay, this is the case for me. Yeah. What of 1 million, 10 million other people that I remember doctors, the ratio of doctors to patients, the ratio of nurses to patients is really low. It's below even the recommended numbers by WHO. Yeah.
Yeah.
So to bridge that gap, then we thought we need to build this system in which, as a patient, I'm able to access a doctor wherever I need to, for even the simplest tasks as asking for the right food. Yeah. Just that, imagine just something to do with your nutrition. It helps you live a very normal life than someone who is not sure of what to take, is diabetic, anakula ugali the normal way, because hakuna mtu wa kumadvise mwambia okay, kifika hii level you need to take more of greens, you need to stop taking this. If you want to party and do this, you need to avoid these things. Yeah. So that's basically the motivation around it.
Yeah,
and also I think for my team, it has been an exciting journey because we learn every now and then we learn new things. We are just excited in discovering new ways of doing things, and participating in building technologies that change the lives of our people in the country.
Wow, amazing. So I want to bring Cliff. Cliff, you keep on coming. Maybe can you unmute your mic? Then you can bring your perspective on to this conversation. Can you unmute your mic, Cliff? Cliff, can you unmute your mic? All right.
I think he is frozen.
Frozen again. All right. So I just want to maybe everyone now to give their to actually maybe ask their question or perspective in terms of how young people can actually maybe go out there, come up with solutions that bring impact in this society, in Africa, and even globally. So I can start maybe with your colleague Arnold. Maybe Arnold, you can bring your perspective in this, how we motivate as young people, come up with solutions that bring great impact in the global scene. Arnold?
Yeah, so maybe I think the best advice would be to start with the small things that affect your daily life. For example, for us Kadenge, you had him talk about his grandma and how she's she's diabetic. So probably if you're seeing, if you're facing a problem in your daily lives, with someone close to you, then if you're finding that to be a problem, there must be a way that you can solve it. And the way is just to try and see how it works, and bring that to a larger scale, and so that you can help the community and everyone involved.
Awesome, great. So, Cliff, I just want to bring you, but your network keeps failing. So, can you maybe unmute your mic and bring your perspective to this conversation? You can actually ask any question to Kadenge. I hope you have not frozen again. Can you unmute your mic? Cliff? All right. So, I'm sorry. It seems he might not contribute on this tonight. Are you okay now? Can you unmute your mic? Good. Okay, sorry.
Yes, give him a second.
Okay.
Yes, go on.
So let's come to Conrad. Conrad, maybe your perspective in terms of how young people we can actually focus on bringing solutions. We have been having this conversation, and I think COVID-19 is a reset button for young people. How do we effect?
I think my perspective will just be probably a search on it, and I didn't hear about it. But my perspective will be the current situation we are in, and how, because we had discussed this issue previously in our previous discussion, how telehealth will help us manage COVID-19. And part of the reason was the kind of system we have in place where we are admitting everybody who tests negative, and they have to be manned by a physical doctor who has to monitor them and see them. And we had discussed the issue about a system where I think the president launched it a while back, but it was mad with controversy about the timing and the kind of message he was revealing. But it was something timely, because where he was launched about the Google Loon or something like that, where this for internet comparability across the country. So my thing is, like, for the Kadenge, their system, they should now start thinking about how can that system be used to managing, because we are looking at the solution to this current situation we are faced with. Most of these people we are currently having these COVID cases, as we have been told that by the Minister of Health, most of them are asymptomatic. They don't need to be in a hospital, but more or less they are in a hospital where they have to be observed by doctors, but we don't need them to be there. So they should start thinking about how that the system can be incorporated in managing these cases, because in other countries, like in Europe, as we have discussed previously with other panelists from those other countries, they have been telling us that majority of these cases, unless you are having severe symptoms of COVID-19, unless you're having critical case of COVID-19, the cases you have to manage them, you have to self-isolate from home. So they should start looking at the ways of which to incorporate this system so that it can be able to manage what you have currently. These cases are symptomatic cases, these mild cases, these people with limited symptoms, to manage them. Because we have an issue, probably we can talk about socioeconomics. We have currently some people you cannot self-isolate from home, probably, but if you can have people who can be able to, a system where these people can be able to access to a doctor without a doctor being physically present there, because they don't need to be there after all, because this is a case of where these people, they've been to do the bulk of the work, but the doctor just have to observe them and see, like, how are you progressing? Like today, you can tell me, like, how have you slept? How is your fever? These are things that can be done remotely by a doctor somewhere in Nairobi. So we should start thinking in that line, in trying to manage these cases we have currently. But in real essence, I've really liked the application, and I wanted to use it for something, but it just happened that I didn't. I got some other extra thing. I didn't. But it's something that it is very practical, because you have you have the capability of accessing a doctor of your own choice. You go and look at a doctor, you ask him whatever questions you have to ask him. You have the confidentiality of talking to a certain doctor without you being prejudiced to revealing your certain element because most of the things I work in the community, so I know like most people are prejudiced. They think like if a doctor comes from my community and I'm talking about a certain disease, so they think like this doctor will be looking with me like a certain eye. You have the same thing about church also. If you look, you are a Catholic, you look at the same thing. Look at the confession. People say like this priest will look at me with a certain eye. So it's the same thing with doctors and the rest. So I think it's very timely. But now we need to look at this is just a challenge to them. They need to look at how we can incorporate because this is the thing we have been discussing previously in our previous session. We are talking about how do you manage these asymptomatic cases, which will pile up. In case you have 100,000 cases, there's no doctor, there's no healthcare workers who can manage all these cases if you are isolating them in a hospital or in a certain setting. But if you have technology, they can be isolated because these people they just need to be fed only. It's just like a boarding school for feeding people. Then some doctor will just be observing them saying like, oh, today, Patrick, come here. How are you feeling today? I'm feeling very good. How is your fever? Blah, blah, blah. You say like, good, it's okay. They're able to monitor you remotely from a certain location without them being physically present. So I think that is just my take on this issue. And I think it's a very timely thing. So they need to just think about expanding the scope on how they can manage with the current situation we're having, because it's very timely.
Yeah.
Because when you talk about the Zoom and the rest of the things, they cannot be practical in this setup, but these are the things that are practical. These are local solutions that are practical in our setup currently.
Great, amazing. Thank you very much, Conrad, for your perspective in that angle. So I really wanted to give Cliff opportunity to give his perspective in this conversation. Cliff, to give his perspective in this conversation. Sorry. Let me unmute. Conrad. Let me unmute. Okay, good. Let it stay that way for a minute. Okay, so Cliff, can you bring your perspective in this conversation? Can you unmute your mic? And if you have any question to Kadenge, you can ask any question, and as well as you can offer your perspective. We're almost finishing. All right, so I'll just bring Cliff. Maybe he has some network issues, but he has. There's a question. He's saying an investigation was done last year on the time taken for one to receive medical care in different hospitals across the country. The results were shocking. So he left again. I think he wants to ask a question about that. Kadenge, you can unmute your mic.
So actually that's last year I was having a conversation at KTN. Yeah. And that's one of the things that was brought forward during that conversation about the time that it takes. Actually, the research said you wait a minimum, on average, people wait a minimum of 2 hours before they gain services. Yeah? And that in that case, then you will find that having this mobile application will be very useful, because one, you are able to talk to a doctor at home, which means that is really quick at your convenience. You don't have to go to a hospital and wait for that long. Yeah? And for hospitals that use the Uzima system, the system is designed to ensure that these inefficacies are reduced to the minimum. Yeah. So one thing is that using the mobile application, you can book an appointment prior to going to a hospital with any doctor that is using the Uzima is within the Uzima ecosystem. Yeah? So that means it eliminates one thing, you going there too early or going there too late for you to go and see a doctor. So if you're to see a doctor at 10, you go there at some minutes to 10, and you know at 10 the doctor will be there to attend to you, and the doctor is very much aware that you're coming, and the doctor is prepared. So it reduces a lot of time wastage, because one, you don't have to go through the normal reception. Your record is already within the system. Two is that the time that it takes for them to retrieve your file is reduced. We did a research and it was taking around 15 minutes to just get your file retrieved from a bunch of other files. We reduced that to a few seconds. By them typing your name into the system, they can retrieve that. And then in terms of consulting with your doctor is always has all the information they need to make a decision. So we also reduce that time for doctor to patient interaction. Yeah. So we took this number of efforts to ensure that the time that you spend in a hospital before you get a service is reduced to the minimum. And in the near future, we are looking at instant services. You go to a hospital, they know everything that needs to be done, because you have already talked to your doctor through the mobile application. So you go into the hospital, they know which checkups that need to be done, which labs need to be done, and then you can actually walk straight into a hospital and go straight to the lab, because yesterday evening the doctor recommended specific labs, and the lab has already prepared for you. Yeah. So all this, we cut all this time wasted bare minimum.
Great. Thank you very much, Kadenge, for that. So I just want to get to the last session, the last parts of this conversation. So I want to give Conrad and Wekesa maybe opportunity to give their parting shots, and then we'll give you time maybe to talk about the future of Uzima Health going forward, and what's maybe your last parting shots in this conversation. So we'll start with Conrad. Conrad, your last parting shots, and then we go to Wekesa, and then Kadenge will do his last remarks.
So I think about this application and the rest of the telehealth, we have been talking about it here several times. We are talking about telehealth is a thing that we need to have in our ecosystem, especially in this current situation we are faced with. So I think such applications like Kadenge's are very timely applications that aim at helping us achieve access, cost effectiveness of healthcare access. So those are the key issues that we are looking at: the access point of healthcare and the cost effectiveness of access, because those things go hand in hand. And we are looking at the quality of healthcare system, because those are the three things we discussed in a previous session, where we have to look at the quality, the access point of view, the cost part of view. So in terms of the cost should be something that is commensurate to the local economic situation, which I've looked at the app, it's very commensurate. Then we are looking at the point of the quality. The quality, we are looking at the kind of human resource able to give this a certain diagnosis, which I look at it is very commensurate, which can be able to be expanded further. Then you are looking at the point of access. Accessibility means that anybody remotely, whether you are in Lodwar, whether you are in what, as long as you have an access to a certain phone, you are able to access to a certain doctor to give you a certain diagnosis for you, and to refer you to a certain place without you need to travel. And that will also go hand in hand to access the cost bit of it. So I think such applications are very costly, and my urge is just to Kadenge to think this current environment. This is the current environment where I think they can expand it further, to operationalize it further, to look at ways in which they can make it part of our national strategy in terms of trying to look at this disease, this COVID-19. So I think my perspective, this currently is just to tell Kadenge is a good job, is a good thing. I've looked at the app, I've been Now looking at it, I have the application in my phone, so I have been trying to access it several times, but I like to access it one-on-one to access to a doctor. But I think it's a very timely application in this current situation, something that can be expanded further in our current context. So my urge is to continue doing the good work it's doing, to continue thinking big, to continue expanding the scope of the access to Uzima so that it can be operational, because something that the possibility are endless.
Great. Thank you very much.
That is my part in short, the possibility.
Great. Thank you very much. Okay. Good. Yeah. So we go to
Yeah, so we to
Wekesa, your parting shot.
your parting shot.
You are having some echoes.
Yeah, I'm trying to mute Conrad. I'm sorry.
Okay. I think my parting shot will be, first of all, to congratulate my friend Kadenge for coming up with this brilliant idea, and to urge him to continue, even to fine tune it and make it a noble idea. I know young people like Zuckerberg began like this, but right now they are hosting over millions of Kenyans on social media. Yeah, we are live here on Facebook because of that young man. So I want to see a time in history where all Kenyan patients are online because of your great and noble idea. So keep up. That is a good invention. I want to talk to many young people who have listened to Kadenge. He said that he just observed what was happening in the compound with the mother, grandmother, and he picked the idea. So they say that around every challenge there is a solution. Now most of the opportunities in life come clothed in a mask that looks like problems. But most of us, we are wired to complain. We are wired to critic. Critic is good because you can critically think about it. But we are wired just to complain, and we think that we were supposed to, we were born and supposed to live in paradise, not knowing that we can create our own paradise by solving the problems that are around us. And so while you are busy complaining about what is happening, there are people who are figuring out what solution can I offer. I always get my inspiration from the good book. When Israelites were desperate, you know, there's a guy amidst them called Moses. He looked at them and he said, one day I will be your deliverer. For him, he saw himself as he was born to be a Messiah to that generation. Yeah, while one generation stayed in darkness, there was a man who he came up with the bulb and he lit the whole world. So all these challenges we are going through are meant to make some people to shrink and complain, but they are made to waken up some giants who are thinking and using their faculty well. We can choose to see our world as a glass which is half empty, but there are those who are focused on the glass which is half full, and that is what matters. So all our life opportunities are around the challenges that God has put us in. So the deeper the challenges, the greater the opportunities. If you're going through an array of challenges, chances are you are wired for greatness, but don't focus on challenges, focus on solutions.
Great. Thank you very much, Wekesa, for that parting shot. So I want to come to Alphonse. Alphonse, maybe now Alphonse came late, but I know why parting shot.
Yeah, I just wanted to say thank you, Kadenge. I was listening, but I was busy, so I could not come to studio and do what I was doing. But I was hooked up, so I thought now that it's parting shot, I could just come and tell Kadenge, thank you very much. Keep it up, keep the fire burning. Solutions are meant to make life easier, but also meant to make your life imprint in your generation. Speak much. Just know that I'm, as much as I was told, I'm a resident analyst in the poster, and you have not seen this face. Yeah, but I was following, and what you're doing is good. I'm certain you very soon you'll be coming back, and I will be live on the same show, and we will talk much. So I hope that's a good parting shot for today. I followed up through, but I didn't want to join in because I knew if I join in, the host will decide to bring me on board instead of allowing me to remain behind the scenes. Thank you.
Thank you very much, Alphonse. So now Kadenge, now you can take it. Just give your final. What's the future of your Uzima Health? What you think? Yeah, take it.
Yeah. So to start with, I really appreciate this opportunity to talk to you, to engage like-minded people in sharing ideas around telemedicine and what can be done and what ought to be done for our people. So it's been a pleasure to be here. The other thing is to encourage every young man that the journey is not easy. Trust me, I've been here. It's not easy. It's challenging. But then every time you experience this, you experience these challenges. It means you're growing. If at any moment you're sitting there and everything is running smoothly, it means chances are you're not growing. You're not making any progress forward. So perseverance in developing new technology is key. Perseverance in developing new solutions is key, without which you will do something for 1 week, for 1 month, you feel okay, it's not working, it's not as you expected it to be, but you're not willing to investigate and find out why the solution you're applying is not working. So you need to change, you need to iterate. So one thing, every young man, every young person, work hard, persevere. The journey is always tough, but if the journey gets tough, only the tough gets going. So I really appreciate this opportunity, Patrick. And remember to download Uzima app from Google Play. You just go there and search Uzima app, or you can Google search Uzima Health. You go to uzimahealth.com, you learn more about us. You can reach us on every social media platform at Uzima Health on Facebook, at Uzima Health on Instagram, at Uzima_Health on Twitter. We are social people. We are a team of young people, so we are really excited. We'll be happy to hear from every one of you.
Oh, amazing. That's a wonderful parting shot, Kadenge. And thank you very much. You are really flying the flag for young people very high. And we are really happy that you represent us in that. Yeah. So thank you very much. And thank you for everyone who joined this conversation. It has been real. So asanteni sana. Good night. Yeah, that's it. Asanteni.
Siku mwema. Bye-bye.
Bye-bye.
Baby, it's me full of Nahisi umenifunga minyororo ya mahaba hata kwenye giza